as I get started, what I want all of you guys to do is everybody stand up, go at the end, all right? And then 3 of you at a time come, walk in the midline, and then 2 move here and 1 move there.
It's a test.
You guys have no clue what you guys are getting into. All right, so 3 people come, and then 2 go here, 1, then next 3. So 1 over here. These are special people. So.
Not even in the room.
So 2 and 1. So yeah, 2 and 1, 2 and 1.
All the way up here?
Yeah, yeah.
Oh, all the way up here. Oh, okay, all right.
Keep going. 2 and 1, 2 and 1. 2 and 1. Doesn't matter which one. 2 and 1. Getting crowded over here. We're almost there. Keep going, keep going. 2 and 1.
And I'm not coming up there because I know what you're doing.
All right. So all the ordinary folks, you guys go and sit down. You guys.
No, you're over here.
That's all. You guys are ordinary. Go and sit down. You guys are special. So 1, 2, 3, 4, 5, 6, 7 special people. All right. So all of you go to the end. All right. Back again, and then I'll tell you one by one. You guys can come. So remember, Sarah said 1/3 at Alzheimer's. These are the special 1/3 who have Alzheimer's. All right. So Alzheimer's occurs in stages. It's all continuous. All right. So this is stage 1, where there is no symptoms. Okay. Then over here, when you reach, it's stage 2, when you have slight memory problems. My wife thinks I'm stage 3. Right? This is stage 3, where you have not only memory problems, but if I do neuropsychological testing, I will say, guess what? You do. But you can still function as a lawyer. Okay? You have to just do everything slowly, a lot of notes and this and that, but you can still manage. This is stage 4. Right? Here, you not only have memory problems, but now you're having difficulties functioning as a lawyer. All of you, right? This is stage 5, where you're not only having trouble functioning at home, but you're having trouble living independently. So some of you might have to go into the nursing home or assisted living, or some family members have to stay with you. Stage 6 is where it's called severe stage of Alzheimer's disease, where you might not even remember family members. You might not remember their names. You might identify your own spouse of 50, 60 years as somebody else, your father. And then you have stage 7, which is called end stage. All right? So some of you walk slowly and some of you walk fast. Do it to you. I want fast. Up here. So that's all right. So as you guys are walking, you guys are aging and going through different stages, right? So in what stage did you develop Alzheimer's disease? At the beginning? So that's correct. So currently we have brain scans like amyloid scan, which if I do, I'll have to charge you $4,000, maybe $4,000 for the center who does it and $1,000 for me. So the amyloid will be lit up in your brain, all right? So then you are amyloid positive, but you have no symptoms, so you are called asymptomatic or preclinical Alzheimer's. Everybody with me? All right, so then you have stage 2, so you're having slight memory problems, but no objective evidence of, so if you come to my office, I do paper and pencil tests, you'll do fine, and so on and on, all right? So over here, even if I do neuropsychological testing, it won't show up. But by the time you reach over here, it'll show up. By the time you're in stage 4, I may not have to do any neuropsychological testing. Just paper and pencil test, it'll show up. It'll be very hard to pass. In stage 5, and believe me, I have patients who come for the first time, they're already in stage 5. And guess, how do I diagnose them? I just get the history. Because this has been going on for so long that I don't have to do any paper and pencil tests. In fact, if I do, it'll be a negative experience for the person because they're going to fail every single question. They just won't be able to do it, right? So again, we have to remember that the Alzheimer's is continuous. But the remarkable thing about the brain is that some of you walk slowly, right? So let's say that you are in stage 1, all right, preclinical Alzheimer's, age 50. Now you're walking slowly, so you're age 60, age 65, stage 2, all right? So slight memory problems, but no objective finding, all right? You're walking slowly, so 70, 75, 80, you're in stage 3 where you have memory problems that I can detect, all right? But still you can function as a lawyer. And then you're walking slowly, 85, 90, and then you pass away, all right? And the person who made you walk slowly is, so I'm your brain coach. So I've done all kinds of brain exercises, healthy eating, nutrition, and I slowed down your Alzheimer's, and you never developed stage 4, which is dementia. Everybody with me? So, thank you. So again, it's really important, you guys can have a seat. It's important to, number one, realize that Alzheimer's should be seen as a continuum, all right? So as you see all the aging population, every second, every minute, every day, this whole movement, some group is crossing into this zone and the others into this zone. And then in this zone, depending on their age, if they live long enough, they're going to go through all the stages. And even before the research, we knew that some people had Alzheimer's in the brain, which was extensive, and they never developed dementia. So they were slowing the disease down anyway, all right? So it was just their lifestyle. We still have no cure for Alzheimer's disease. But with lifestyle, if you slow down, and if you die because of, say, heart disease or strokes or cancer, technically you'll develop Alzheimer's after you die. And I'm fine with that. So keep that in mind, and that's what refers to these 7 stages of Alzheimer's. All right? And all the research currently is going on in the earlier and earlier stages. So if any of you is interested in taking part in Alzheimer's research, we need people to take part. I have some websites that you can go on the website, register yourself, and they will contact you to tell you which studies you might take part in. Some of the studies, you might even get a brain scan, the amyloid scan, and if it is negative, you will be told that you're not eligible. That's a good thing, because at least you know you don't have Alzheimer's disease. So again, if somebody has been diagnosed with Alzheimer's, dementia, all right? So remember, dementia already stage 4. So the disease has been going on for 20 years, all right? And if I do an amyloid scan and it's negative, do they have Alzheimer's? No. Because remember, Alzheimer's is going on for 20 years. So the amyloid is going on in the brain, accumulating and accumulating and destroying for 20 years. And it doesn't disappear, which means that you have to see amyloid for you to be called Alzheimer's dementia for you to have that diagnosis. Everybody with me? But lot of people, up to a third at the age of 75, may have amyloid in the brain but no dementia. So amyloid positive scan won't help because you may not develop dementia at all. A lot of people die with amyloid in the brain. This is no different than if you have, say, prostate cancer. If my PSA, prostate specific antigen, was elevated, I may have prostate cancer, but it's so slow that I will have metastatic cancer at the age of 95. And if I die at the age of 80, why even bother to treat, right? So we have to keep that in mind. Our view of Alzheimer's is still the old view, where it's horrible and this and that. At least in the circles that I practice and all the neurologists and psychiatrists and primary care physicians know, it is like prostate cancer, it's like diabetes, it's like heart disease, it's like stroke. People can have small strokes and nothing happens and they can lead a very good life, and people can have massive stroke. Same thing with diabetes. So it's a spectrum where, number one, you might be in a spectrum of, say, stage 4 dementia, right? But it's still mild. And if you get all the blast of the current treatment, which is not great, but it's still there, something, then you can slow down the disease process so that you will take, say, twice the time to reach stage 5. And that's when you need some family members home, right? That's not a bad deal. Instead of 2 years and then you need family members, it's 4 years. There you go. And then if you push it back even further, then you might avoid nursing home placement completely because you will pass away because of, say, again, heart disease or strokes or cancer or something else. So again, we need to keep that in mind, because if people call you and say, why even bother? This is the reason to bother. Our brain is neuroplastic and we can slow it down. And currently we have only 2 types of medicines that can help in Alzheimer's disease. In Europe, they have approved something called transcranial magnetic stimulation that you get. So your brain is being stimulated with magnet, and you're doing cognitive training 1 hour a day, 5 times a week for 6 weeks. Are you with me? And that has been also found to be helpful in addition to these pills. Plus if you do exercise, plus if you have Mediterranean diet, plus some fancy stuff that I can only tell you with certain green transfers. So plus socially active lifestyle, plus stress management, plus meditation. So it's like a part-time job, all right? You'll be spending 20, but it's worth it. Seriously. I have patients who are doing it, and other doctors, other neurologists have described that. In the books that I've recommended in your handout, you'll see real life stories about all of that. So again, keep that in mind, that a full intensive treatment can really have a fantastic effect on how quickly the disease progresses. In some people who have stroke, you'll see that they have gone from, say, stage 2 to stage 4. It's because they had Alzheimer's and then something else has accelerated. Traumatic brain injury, acceleration. If you don't take care of your hypertension, you're going to walk faster. If you have diabetes and blood sugars are very high or very low, it's all going to accelerate. So this is the way to see Alzheimer's disease. Again, the good news is that 30% of people who are diagnosed with Alzheimer's have negative amyloid scan. What does that mean? They don't have Alzheimer's. Because remember I told you, if you don't have amyloid, you can't have Alzheimer's. If you have amyloid, doesn't mean you have it, because a lot of people can die with amyloid in the brain. So keep that in mind, that not everybody gets diagnosed with Alzheimer's truly has Alzheimer's. And to me, they might have many other causes of dementia. As Dr. Taves mentioned, dementia is an umbrella term. Anybody who has decline in memory and can't function, dementia. That's it. Simple diagnosis. But you can have dementia because of thyroid dysfunction. I fix your thyroid, I've cured your Alzheimer's. Well, you didn't have Alzheimer's, right? If you have severe depression with some memory problems, you get diagnosed as stage 4 Alzheimer's dementia. You come to me, I treat your depression aggressively, you go into stage 3, which means that now you don't have dementia, you have some memory problems, but you can still function. What have I done? I've reversed Alzheimer's. Actually, yes, because some of the functional problems or more memory problems are because of depression. All right? I have a patient who gets diagnosed with Alzheimer's dementia. They are on 25 medicines. I discontinue, with the neurologist's help and the primary care physician's help, 9 medicines. And now the dementia has cleared up. Did I cure Alzheimer's? No. The dementia was because of medicines. You guys get me? I can go on and on with another 15 causes that are all reversible or partially reversible. So if you had to pick one, that would be the most important reason to get assessed, is because all your fears are not true at all. So again, we have to keep that factor in mind. To me, Christine went through all the differences between normal and abnormal. But the key thing to realize is that you have to compare it to that person, right? See, if the person is functioning at a very high level, then those differentiating criteria won't work. One of the handouts you have is on the cases. So look at this. Mr. Joe is a 74-year-old person working in an investment firm as a money manager. He has been having memory problems for the last 2 years, okay? And this is what he says. I watch a movie and lose the thread of it. I drive right past my destination. I used to have a fantastic vocabulary and now I search for words. I think my brain cells are dying. I see a consistent failure in cognition. And the wife says, you know what? I've noticed too. The other day he could not remember our home alarm system security code, a number he has punched 1,000 times. That's not Joe. Joe can recite telephone numbers from memory. Now, if I did paper and pencil tests, I won't be surprised if he scores normal. So then how do you reconcile a normal paper and pencil test in my office with all this history? It's because he was at such a high level that his decline is still above average, so he scores normal in paper and pencil testing. He won't be able to score normal in neuropsychological testing, and he didn't. And his amyloid brain scan was positive. Plus, he took part in research, so he had CSF, spinal fluid, and that also there are tests to show that if you have Alzheimer's. So his amyloid was low and tau protein was elevated in the CSF. He also wanted to do genetic testing, and he was ApoE4 positive. That's bad news. All right? So if you have ApoE4 one copy, then you will get the disease. If you're going to get it at 80, you will get it at 75. If you have 2 copies, you'll get it at 70. Right? But you may not have ApoE4 at all. You may have ApoE3, which is most common. Then it's neutral. It doesn't sort of accelerate the disease process. If you have ApoE2, which is rare, unfortunately, only one of us has it over here. All right? It's 2% population. But if you have ApoE2, you'll push the disease back by 5 years. And if you have 2 copies, all right, you'll push it back by 10 years. So in the future, we'll be doing all kinds of fancy testing for individual risk determination. Currently, we do that just to be more sure that you have Alzheimer's. Because as Dr. Tave said, there's not one test, that will. So dementia is a clinical diagnosis. And then you have to go to the next step, find the type of dementia. Is it strokes? MRI of the brain will show if you have strokes. If MRI shows no cerebrovascular disease, you don't have vascular dementia. But then you can have Lewy body dementia. That's a totally different entity compared to Alzheimer's. It has different protein in the brain. Then you have Parkinson's disease dementia. But there it's clear. Somebody has Parkinson's disease for like 10 plus years. But then you can have frontotemporal dementia. Then you can have other rare dementias, we call it rapidly progressing. So I have one of the handouts is on tests. And a lot of times family members say that, but he won't come and see you. Or he won't go and see a neurologist for dementia workup. I said, no worries. Don't even say anything. just say it's a routine visit from to the primary care, and you give my sheet, which it says routine dementia workup. And the primary care physician says, hey, how are you doing? We need to do some tests just to make sure that, you're doing great and you continue to do great. Because the person doesn't think they have memory problems, The spouse is just making a big deal. So that itself is a sign, by the way. If the person says no and the spouse is saying, no, it's bad, to me this is dementia, right? You have to just find the cause, So, one of the reasons, don't take your spouse if So you can still do a workup and at least make sure that you're not missing any reversible cause, right? Obstructive sleep apnea, electrolyte imbalance, vitamin deficiency. Now, a little bit of reality. You can have both. What does that mean? You can have Alzheimer's dementia plus medications causing memory problems, right? So then if you fix this is not going to be fixed. But that's all right. At least you have got some of your function and memory back, right? So another reason to see is that even if you have Alzheimer's, 80% of people have all these small reversible factors that we can fix. So, am I making sense? I think we've covered much of it, and again, I can go on and on and on. But I would rather, answer questions or make sure that all of you have digested all the information that Sarah and Christine and I have given. And I need to know how much time we have.
Another 10 minutes if you need it.
Yep. I always need more time.
How early is amyloid detectable?
How early is amyloid detectable? So, at least 20 years before dementia. And there are 5.5 million with dementia in US, all right? 47 million in the world, okay? 500,000 have the onset before the age of 65. So their amyloid started at least at the age of 45 and maybe 40, maybe 35. Because remember, I said at least. If they have disease can start at age 30, but it's slow, so in some person it might take, say, 40 years before you develop dementia. So they develop dementia at the age of 70, but amyloid positive for, say, the first 15 years. So you're in stage 1. Another 10 years, you're in stage 2. See that? And then there are other factors that will influence. So if, let's say, you develop hearing deficit, it accelerates it. If you develop diabetes and hypertension and you're not taking care of it, it'll accelerate it. So if you go by that, 47 million in US are amyloid positive. So again, the reason is not to scare you, because I don't think we need to get scared. In fact, the reason is to be optimistic, because our brains are very neuroplastic. It's remarkable. It doesn't matter what you lost. It's how well you use what you have. And you can, it's like a muscle. You can really, water it, and it'll grow, and avoid watering, networks that you don't want to grow. Pessimism and giving up networks. Everything crystal clear?
I have a question. Well, actually, it's a two-part question. Over the last 10 years or so, I've kept reading that Alzheimer's is increasing. Alzheimer's is increasing.
Mm-hmm.
And so question one, is that true? And question two is, if so, why is that? Why is it increasing? Is that because we recognize it easier? Or is it just because something about our society or environment causes more per capita, or we live longer, or what is it?
Live longer. It's really staggering. It's like we never realized that some of us will really pay a heavy price for living longer. And it's never seen in the history of humanity. People have not been living this long at such a large number. All right? So that's the main reason. But again, that's like, ignoring epigenetics and environment. All right? meaning that if you change your environment and lifestyle, you will change the activity of the genes. So let's say you have 15 different genes, each one in a small way is causing you Alzheimer's. Depending on the lifestyle you lead, you can actually downgrade the activity of the gene, you'll slow down the process, and as I said, you might die of something else. So I personally, although the steady answer is yes, Alzheimer's is increasing primarily because of age, but also the new generation is really taking cognitive health much more seriously than the previous generation did. Because at that time we thought, nothing can be done about the brain, what we have. Now we know that that's not true. That's just not true. Yes?
Are we aware which medications cause memory loss?
Yes. Are we aware what medicines can cause memory loss? So just about anything that affects the brain can cause, but there are 3 categories that are sort of, quote, most dangerous. And again, in the books that I've given you as resources, it's all there. But one is benzodiazepines. You might have heard of Valium, Xanax. So no, in terms of memory problems, all right? The second is called anticholinergic drugs. So there are certain drugs that block a brain neurotransmitter called acetylcholine. And that's the neurotransmitter that's needed for improving memory problems. That's why we give drugs that are like Aricept, donepezil, that increase the neurotransmission of acetylcholine in the brain. So no point giving them drugs that block that chemical. First of all, these drugs they're not like phenomenally effective. They are modestly effective. But if you give drugs that are blocking that chemical, they won't be effective at all. And some drugs are highly anticholinergic. They are really bad. Example would be Benadryl, over the counter. And some drugs have small anticholinergic effect. But if you have 5 of those drugs, we have a problem. So if you come to me, we might do an anticholinergic burden. So generally I work with a pharmacist. It gets really very complicated. So, and it's hard to even keep track of all these new drugs. But you can do an anticholinergic burden and try and reduce the burden, try and replace one drug with more neurotoxicity with another drug. And the third group is opioids. But there's a much longer list. So, yes?
If Benadryl is one of those drugs, are people who take allergy drugs at risk? Are they all in that category?
No, the older allergy drugs, yes, because they had this anticholinergic property, hydroxyzine, Vistaril, but the newer drugs don't. So we've made progress in terms of having better options. It's just that, the minute you go above 5, 6 medicines, I'm not so sure, whether the pluses still remain or whether the pluses quickly are offset by minuses, So there's so sometimes we have in the memory assessment and all, we have a whole separate appointment for de-prescribing. Chop. So it's bizarre, you're giving medicine to one physician for prescribing, and then you come to me for de-prescribing. Is that the best use of Medicare? No. It's good for us, we get paid anyway. But I would not endorse it.
I'm really curious to hear from, as you think about your role as committee members that may be working with someone that's struggling with the situation or has been referred to you. I'm curious as to how this information is resonating for you.
I'll just speak. What it's helping me think about is sometimes from time to time I'll get a call with a concern about someone. And I think some of the presentations have helped me maybe have a better understanding about normal aging versus, that's a problem. Not that of course but it just helps me have a better sense of how concerned I should be and what some of my possible well-being referrals could be.
Did that get caught on your tape? Great.
I think it's helpful to know that there are things other than Alzheimer's that may be causing the problem. And we can talk to somebody about whether or not they've been to their doctor, whether or not they've checked their medications to see if there's any interactions. Plus, we can give them phone numbers to call, look up symptoms and that sort of thing and go through with them. And maybe talk to family members and see what's going on and let them know. It might just be as simple as a medication issue. I think that, to me, is the great message of what you have to say is there may be issues that we can take care of, and it's not always bad news.
The other thing that really resonated is sort of the importance of treating your other physical or mental health conditions and the holistic approach to well-being that is, I just think when you look at, I'm looking at the brain fitness program to slow decline, and item 12 on there, there's things on there I wouldn't have really necessarily, first, I'm not a healthcare provider, that I would have not necessarily linked as affecting cognitive decline. I mean, it's everything from your sleep to depression to diabetes, hearing and vision. I just thought that was really, just highlights the importance of a holistic approach to well-being.
And just let me highlight that. So in sleep, the amyloid is cleared up by the brain, right? So we all fix our own problems. Sometimes it's just not enough. Twice as fast as when we are awake. So sleep is really crucial for healing anything, just not Alzheimer's, okay? And same thing, our body are sending messages to the brain and brain is sending. So if they have decreased hearing input, we just don't realize how much we are so intellectually intense in our current lifestyle than, say, 100, 200 years ago. That if you lose auditory function, the brain function really dives. Same thing with vision. We take it for granted. And these are brain stimulating systems, the vision and the auditory. I haven't said as much of touch, but in the future that'll come into play because we don't have enough research. But I'm already seeing it, that we need to live a way more sensory life than sort of intellectual life, But again, we're just so hypnotized by intellect that we just don't realize that.
Any questions?
So we've been advising individuals to see their general practitioner. Is that still?
Not on the list because they are now should we be advising that they should see their primary care physician? It doesn't have to be a physician. It can be nurse practitioner, physician assistant. They are really getting better at basic assessment. So it's good to at least have that because then at least you're not worried about vitamin deficiency, thyroid dysfunction, brain tumor, subdural hematoma, blood clot, and that's a good start, So, oh yes, if you have to have just one thing you can do for this person, get them to the primary care and say that if they can do a cognitive workup. We don't have to even use the word D word, dementia, or A word, Alzheimer's, Thank you.